For our third lecture, we're going to talk about the muscles of the arm, specifically mostly the upper arm, and then the forearm we're going to break into some major groups, and we'll tackle them more specifically next week. We're also going to talk about the rotation of the bones. I think week 1 we mentioned how the radius and ulna rotates a little bit, so it gets kind of complicated. So we'll make sure we have an understanding of that. And then, that's pretty much it. So it's not a huge lecture this week. Next week it can get a little confusing because we're dealing with the hand as well. So we end up with a lot of information next week. But this week should be fairly understandable. So let's talk about the bones first. We're only dealing with 3 bones this week. We have the upper arm, the humerus, and then we have the 2 bones at the distal end of the arm, the ulna and the radius. To distinguish between the two, it's helpful to start at the elbow. The bone, you feel this bony projection of the elbow right here, that's your ulna. So the humerus and the ulna interlock with sort of a hinge mechanism. So if we can see from the skeleton here, the ulna, or the humerus, extends down and then has this little depression here, and that depression is where the ulna is sitting in. So that's that's a little long. There we go. We have our humerus and then our ulna, and then they operate with this hinge mechanism. So seen from the side, it looks something like this, and then the ulna rotates, or not rotates, I'm sorry, hinges. So it just rolls over this. You'll notice that the back of the ulna has a little bony ridge, and the back of the humerus has this little depression here, and that's where that bony ridge sits into the depression to make sure that your arm doesn't keep going back and snap all the way back. So it's sort of like this guy here. It's got this little cradle. And so as the arm extends, it stops right there to ensure it doesn't go too far and break your arm. Hinge joint is the mechanism by which the humerus and the ulna operate. And then from that we can build the extra bone, the additional bone, the radius, on top. So we look here and we have the humerus, and then we just follow the elbow down for the humerus. You'll note at the end of the hand, the arm is set this way, so on our skeleton here. So the ulna ends at the pinky side of the wrist. So you can actually feel it here. This bony projection on your wrist, on your pinky side, this is the distal end of your ulna. So that tells us if the pinky side is the distal end of the ulna, then the thumb side, conversely, must be the distal end of the radius. And when we move upward, we'll actually see that the radius is going to be set on the outside of the arm. So when we look something like this, the radius is going to be out here and run straight along down. So when we're seeing the arm, this position here, palms facing forward, this is sort of the natural unrotated view of the arm. So if we were to build on top of this here, this of course being the lateral side, and we would build the radius right down here, and the radius gets a little wider toward the bottom. So in this position, our arm is straight out extended with the palms facing forward. Lucky for us, our arm has a little bit more mobility than that, so we can open doorknobs and turn things right and perform the vast range of activities that we do with our arms. It does that because the radius is free to rotate around the ulna. So you can see even in this situation, or the skeleton here, the radius rolls over the ulna and allows the hand to be positioned down, or palm side back. So this is the action that takes place. The ulna stays the same, and the radius rotates around the ulna. You'll notice it gets this spiral motion in the arm. So we can actually follow the radius in the arm as it spirals over the ulna. Keep in mind the ulna doesn't move. The ulna has a fixed attachment point to the radius, and it always stays sort of stationary at the distal end of your arm. It's the radius that's wrapping around the ulna, not the other way around. So the thumb side's always swinging over the little pinky side. Meaning, also, this should let you know that if you start with palms forward, you can only rotate in. You can't rotate outward. You always rotate inward. So if we follow this position, this would be, I'll draw a simplified hand here. In this case, if we draw like a mitten, this is our bones with hand palm forward. And then if we were to rotate our radius over our ulna to do palms back, then we take this, the radius stays the same position up at the top side, but it rotates over the ulna down here. And so we have this new orientation. In which the thumb side is down. And we'll draw knuckles back here to show that it's knuckles. So we need to have this understanding of how the rotation works, because whenever you see a hand with the palm down versus palm up, or dorsal side towards the viewer versus palmar side towards the viewer, we need to make sure we indicate this twisting of the arm that we see. It becomes very prevalent. It's a spiral sort of twist down here, where we can follow the bony ridge of the radius all the way down to the thumb side. So on the test, for example, you'll be given an arm in a variety of poses, something like this, or like this, or out, or however, and your task is going to be to draw a diagram of how the bones should be arranged. Is the radius on top? Is the ulna on top? Is the hand facing forward? Is the hand facing backward? It doesn't have to be as complex as this. It can be a simplified version. Bridgman has it set up very simple, so that represents the humerus, and then the ulna is broader at the elbow attachment and narrower at the hand attachment, and then the radius is the opposite, so the distal end gets a little wider. So your diagrams that you draw on the test can be something like this. And by drawing the bones, sort of diagram form like this, it'll let me know which one's the radius and which one's the ulna. You shouldn't have to label these. If you have to label these, you have not drawn it correctly enough. So you need to make sure as you overlap the bones, you erase out the side that's underneath, so it appears that one is overlapping the other and there's no ambiguity there. We're testing to see if you have an understanding of what the bones are doing underneath. If you have an understanding of that, that'll also tell you whether or not a muscle is being initiated to cause the rotation, and it'll let you know which muscles to seek out and describe in a little more clarity. So that's going to be an important understanding, and we'll actually build some muscles on top of this to help you figure out how that rotates as well. There are some Bridgman drawings in the textbook listed that you should do to aid in this understanding. They end up being a little bit diagrammed, sort of like I just drew over here, showing some of those rotations and bendings as well. So those are our bones. Humerus, ulna, elbow down to pinky, radius, lateral side of the antecubital here, the front, down to the thumb side. It won't be on the test, but just for everyone's clarification, when we refer to the elbow, it has its own name, the LEC200 process. It's listed in Bridgman. I think you'll end up writing it with the homework. So the LEC200 process describes that area where the bones are interlocking and everything associated with that hinge motion. So we can say the LEC200 process to describe that. Elbow, common name to describe the posterior side. The anterior side is called the antecubital. antecubital. Antecubital refers to the front side of the arm, of the elbow here. That takes care of the bones. So let's go ahead and talk about the muscles. Let's first start with the muscles of the upper arm. These are muscles that I'm sure everyone in here is familiar with, whether or not you've had any medical training, because we've heard them in everyday life. First we have is a muscle on the humerus, anterior side, so front side of the humerus, called the bicep. So the bicep is this bulge right here, right in front. The bicep, it's bi because there's two heads of attachment point, giving you power. And what does that power do? Well, when you contract your bicep, you lift your forearm. So the bicep helps you to bend the arm at the elbow and lift things up. So if you want to develop your biceps, what do? You lift little dumbbells. One other muscle that we're going to see on the front side of the arm is actually sandwiched in between the bicep and the humerus. So we have the humerus, we got the bicep on top, and then underneath the bicep we have a muscle called the brachialis, sometimes referred to as the brachialis anterior. So the brachialis anterior is more of a broad, flat-shaped muscle, and the only visible portion of the brachialis is going to be the lateral side, sort of along the outside here, running from the top down almost to the distal end of the humerus, and then a little sliver along the inside of the arm as well. So if we look at our bicep, we're going to have our bicep. We might see a little bit of the brachialis running along the top outside here, and we might see a little bit of the brachialis along the inner side as well. Again, that will depend on how developed the muscles of our model looks or are. That's it for the front side. We have the bicep. And keep in mind, because it's a bicep, we may see two heads, meaning we'll see a bulge here and then a bulge right next to it. So the bicep, and then underneath that, we have the brachialis, and then underneath that, the humerus. The backside of the humerus has one muscle that we're going to concern ourselves with, but it's one muscle that has three heads. Why is that important? Well, consider the front side of our humerus. The front side had a bicep with two heads, and it had the brachialis, which had one head. So we have three heads of power on the front. So in order to have an equal distribution and balance out the power on the front of the humerus, we have one muscle that has three heads on the back side of the humerus. And we'll call that the tricep. The tricep, running all along the back side of the arm. With three heads, we might see it as three prominent bulges running along the back of the arm. The tricep is responsible for straightening out the arm. The bicep, responsible for lifting the arm, the forearm. So we have bicep action, tricep action, bicep action, tricep action. The muscles of the forearm, instead of controlling the hinged motion of the arm, are controlling the motions of the hand for the most part. We're going to talk, for the exception of what we're going to talk about first, which is the muscles that are controlling the rotation of the arm. So everything housed in the forearm here will control either hand motion or rotation motion. And again, those upper arm muscles are controlling hinge motion. So let's start by tackling the rotation motion. And this is where it can get a little bit confusing for some people, mostly because of how Bridgman is worded, and there's some out-of-date descriptions of some of the anatomy there. Now, we'll first talk about descriptions of the rotation. We have specific names for it. We don't just say rotating inward or rotating outward. We refer to it as supination and pronation. For example, if you're pronated, you're turning downward or inward. Lying prone is lying face down. In the case of the arm, pronation refers to the inward motion that you're turning your arm. You're pronating your arm, your hand is facing down, or palms are facing back. Supination refers to the outward turning. Lying supine is lying face up. Turning your hand supine is making palm up or palm forward. So supination, some people think of it as holding a bowl of soup. Supination lets you hold a bowl of soup. Pronation, you dump out the bowl. So supination, pronation. It becomes useful to think of it like that because we have muscles that are called the supinator and the pronator. And you can imagine what each of those muscles do. The supinator will help you turn your arm outward or supinate your arm, turn your palm up. Pronator will turn your arm inward, turn your palm down. Now, if we consider that idea, we can think about how or where the muscles are placed and why. It makes a lot of sense. For example, pronation, if we want our arm to pronate, turn inward, then it makes sense to have a muscle running diagonal down this way. So when it contracts, it pulls the arm, rotates it over the ulna. So our pronator actually starts on the inside, it's right here, and then runs right along the arm and attaches to the radius on the inside of the radius, toward the medial side of the radius. Down here, about a third or so of the way down the radius. So when the pronator contracts, it rotates the arm inward, it pronates the arm. And you can even hold your arm out and do this action. Grab your radius like this, and then just give it a tug, and your arm will naturally fall over. You're doing the work of the pronator by tugging your arm like that. The supinator has sort of an opposing placement, and it starts on the outside and runs about the same distance across the radius and tucks in over here. And so it rotates the radius outward. So we have pronation, rotating inward, supination, rotating outward. So the muscle is supinator placed here, rotates us this way. Pronator placed here, rotates us this way. So we have pronation, supination. The pronator we can possibly see. In somebody who's well developed, we'll see a little muscle like this, running sort of as a band right along the inside here. And of course, when they're pronating like this, we'll see it flexed nicely and lots of interesting shapes happen. The supinator is buried a little. The supinator is a deep muscle. We don't see it very much. However, when supination occurs, the force of the action of the supinator does influence some of the shape of the top muscle. Specifically, a muscle that runs all the way down here. It's this nice meaty bulge here. You can feel it on the outside of your arm, which is called the brachioradialis. Now, the old term for the brachioradialis is the supinator longus, which is where people can get confused. The supinator longus, or brachioradialis, does not have as much to do with rotation as it does with flexion and extension. However, when we rotate using our supinator, we do see the bulge of the brachioradialis. So we want to make sure that we understand and clarify between the two. Bridgman textbook still refers to it as the supinator longus. And then he talks about the supinator. And when he talks about the supinator, he talks about how it runs all the way down to the distal end of the radius, which is not true. The supinator runs about the same way down as the pronator. The supinator longus, or brachioradialis, is the one that runs all the way down to the wrist. So we can see it just all right along the side here, running all the way down the thumb side of the wrist. And that is the brachioradialis. So those are the two muscles that are responsible for rotating the arm, turning the arm inward, or pronating, and turning the arm outward, or supinating. So we have the supinator and the pronator. The pronator being visible, the supinator being a deep muscle. Aside from that, we just have a couple more that we're going to talk about. The extensor carpi radialis longus. It's not listed in your textbook, but It does sort of follow that brachioradialis all the way down, the extensor carpi radialis. It's just the outside of this bulge of muscle running down here. Now we'll be able to see it as a tendon we'll talk about next week, but the bulge pretty much follows the brachioradialis, so we can just look for it right along that ridge. But all of the muscles and as far as flexion and extension is concerned in the forearm are better to think of in terms of their bulky shapes. Instead of isolating them into tiny little strands of muscle, we talk about them as groups. We say the extensor group and we say the flexor group. And the reason that we would opt to do this, instead of isolate them into tiny little muscles, is that frequently, when students do break each of them down into a tiny little flexor, a tiny little extensor muscle, the student ends up with, again, these long bands that look like stripes or striations down the arm, where in fact they often work together and change shape together. It's almost impossible to just isolate one little flexor or extensor and not have the others operating in some way. So we treat them as groups. And Bridgman treats them as groups, and so you get a feel for the overall shape of the muscles on each side of the arm, which can in turn help you render them a little better. And then next week we'll talk about the actual tendons at the end and how those shapes might be apparent. So we look at, again, flexor group and extensor group as opposed to the individual muscles. And it's pretty common sense is where we might see them. You know, when we flex, we curl our arms or appendages in like this. This is flexing. So our flexor group, by that logic, must be on the inside, because if we're curling inward like this and we see a bulge here, it means we're bulging in and we're curling inward. So our flexor group is all along here. You flex your hand and you see this nice meaty bulge right along the anterior side here, a little closer to the medial aspect of the arm. So this is our flexor group here. The extensor group is involved in extending. So extending. So what action is extension? Well, it's extending the fingers outward like this. And to extend or pull our fingers out this way, we must have some sort of strings or muscle group along the back here. And that's these guys right here. So the extensors are all along here. You have extensors, extending. Flexors, down here, flexing. So you have extension. See all the bulges there? And then flexion, all the bulges here. So we're looking for a meaty bulge here. The flexor goes more into a ball shape, whereas the extensor more into a longer tube shape. So we'll just keep in mind the overall shapes of them. And look at the Bridgman book and get familiar with the sort of overall bulk that each of those shapes should take. And then when you execute your Vanderpool drawings, you're going to have to be particular to render the subtle curvature and subtle shape that those groups should take. Only other muscle to discuss or mention briefly is a muscle called the anconius here. And the anconius is going to be on the back of the arm. And it's going to be a little tiny muscle that runs right over here. So if we look at the back side of the arm thusly, we have the brachioradialis here. And then the anconius is going to be sort of this angled muscle right here. Again, you're going to see it a little more, there's a little bit right there. You're going to see it more with models who are a little more defined. But it adds some interesting shape to the elbow, especially when the arm is extended completely and not bent in any way. So we'll look for that anconius. Keep in mind it starts up here laterally and then it swoops downward toward the medial aspect of the arm as it approaches the more distal end of the muscle. So that's going to be it. Just to recap here, upper arm, we're going for the bicep. Underneath the bicep we have the brachialis anterior or brachialis anticus as it's listed in some of the books. Back side of the arm we have the tricep. Moving down we have the brachioradialis, which is starting up here and running all the way down to the thumb side of our radius. We have the pronator in here causing inward turn. We have the supinator over here causing outward rotation. And then we have the flexor group right in here. We flex it. Our wrist comes in, our fingers come in. And then the extensor group on the back side, we extend and the fingers extend, the wrist extends. And then that tiny little anconeus right in there. There is one muscle that's mentioned in Bridgman and still appears on the test, but I give it as extra credit because it's not particularly visible, and that is the coracobrachialis, which is a muscle that you can't really see on the arm, but it feeds into the little beak here of the scapula, and it causes the roof, or it gives you the roof of your armpit, so that the top or the roof of your armpit is created with that coracobrachialis. But it becomes additional knowledge that isn't super relevant to the purposes of us drawing. So you don't need to know that, but it is something that you might stumble across in Bridgman. I think some of the drawings you execute, you will do some drawings of the coracobrachialis as well. Other than that, that's going to be it. You do have some Bridgman drawings and some Vanderpool drawings this week, so make sure you check your textbook to see the recommended list.